If we focus just on very specific apps and the mechanisms within just those apps, then potentially if they become extinct, then what we've learned about those apps might not transfer over to future developments, not without further work in the background. But if we move from the theory and use the theory as the groundwork, and use those to apply general techniques, so what we know about what gets people motivated to use apps generally, or what it is within an app that rewards behaviour that works particularly well at shaping positive behaviours or negative behaviours, then what we develop for those apps will survive even if the app is gone or the platform is gone. So things like MySpace, Vine, things like that might have fallen by the wayside to a certain extent or completely. But if we've approached those generally, then what we've learned will carry on beyond them.
We need to disguise our health interventions because people have got sick of hearing public health messages. We know what we're meant to be doing, we're just not doing it. So we need to come up with a different way of disguising that so that kids don't necessarily think, oh, they're telling me to do exercise again because they just want me to exercise. It's about making it something they want to do for an alternative purpose. Possibly that might be disguising it as an education, thereby getting those healthy habits in place early on. Or it might be just pure and simple along the lines of all these activity apps that are out there now that have nothing to do with activity but have that outcome anyway. I think from a more strategic perspective and possibly a more holistic perspective, there is that getting the right people in the room who want to have those conversations now. And I think it has got to the agendas of the people that matter, but it's about how can we facilitate those people thinking and pulling out the small little changes that will make the bigger impact overall.
I think we all recognise the opportunity that digital brings for health and care in terms of helping evolve healthcare and supporting the prudent healthcare agenda in Wales and supporting integration. There's a massive amount of energy and enthusiasm, interest, but more importantly expertise across health, social care and within the government that is picking up on this fantastic chance to make things more effective and more efficient across the piece. And we've got a population who expect health and social care to be delivered using digital tools. It's what they've come to expect in every aspect of their life. And to be fair, the clinicians, the practitioners, the policy makers all use digital to a massive extent in their own lives. We're pulling it together in strategies, keeping the strategy refreshed by engagement with the public, engagement with the users, engagement with professionals. And we've got mechanisms in place, the National Informatics Management Board with the executive directors responsible for informatics in each of the health boards, meeting on a very regular basis, chaired by the Chief Exec of the NHS in Wales, to make sure we are meeting those demands and understanding the opportunity digital has to help us cope with the massive pressures that are on health and care now. You know, if we aren't doing digital, then what are we doing? And frankly, we can see across the piece some real enthusiasm, some real commitment to doing this. And of course the government is looking at what funding can be made available to make the best use of the opportunities that this presents.
Web interventions need to address users' needs. So people won't engage with websites unless they're addressing their questions and they're engaging and interesting. Repeatedly, young people and everybody tell us that they don't want too much text. So it's very tempting to try and put lots of information into a website, and actually people lose interest very quickly. So quite bullet pointed text with really clear headings. Even better is alternative ways of conveying information. So videos, perhaps audio, animations, cartoons and so on. Interactivity is really important. So actually receiving tailored feedback. So people being able to put in their own concerns and then get specific answers about their concerns makes a good website. There's more. So a theory base is important. So rather than just generic information, actually having an idea of how a website might impact on behaviour. So what's the aim and how is that going to be achieved within a website? So sort of rationally planned.
What's unquestionable is that if we don't meet user needs, our products aren't going to be used. And therefore digital products are not going to be able to meet their potential for helping people manage their health and care and reducing the burden on the health service.
Longitudinal research inevitably tends to be really hard to fund. So you usually find that people do short-term studies. We look at it initially, what happens, but with technology, one of the biggest problems is the novelty effect. So something you implement something, it has a big peak, that carries on, and then after a little while you then start to see the drop. So I suppose one of the things is yes, we need to measure it in the longer term because what has the initial impact, but also some things people then validate after a short amount of time and say they weren't successful, but with behaviour change it takes a long time to actually instill these benefits. So actually having it in the longer term could mean that we could impact on it. It can be done in various different ways. From looking at the overall impact, it's useful to see, well actually, who's it been given out to? So what's the whole outcome? What's the outreach of it? How many people use it? Does that decrease after day one, or can we actually do it? But then more importantly, how can we actually keep that engagement? So developing something and saying, here we go, that's it, isn't really good enough because we need to develop it. Things change every single day with technology. So things like almost a gamification approach whereby you have to do more things. We do different tweaks to apps, for example, and you try and release them over different amounts of time. So you have to do different things to release a different level, which tries to maybe engage that different types of adherence. But the long-term impact on health in terms of even the definition of health is quite difficult. So it's trying to access that, and can we even do it on a subsample of the population is the key question, hopefully.